And then there was the crisis manager role. I had that role for about 2.5 years, and I can tell you it is a very, very stressful job. It is very intense, but you really learn fast as to what you're made out of. And as you go through more and more crises, you start to reveal that there are certain patterns of a crisis situation. And I will say that the good crisis managers are the ones that can identify the opportunities out of those patterns and then use that to make the company land on their feet even better for the crisis itself than when they came into the crisis. So I'm going to share with you the 3 phases of a crisis, and in addition to that, share the best practice of a good crisis manager so that you can use that for yourself to get that next job, to land better on your feet, so that you guys are ready to go as soon as this whole crisis is over. First phase of any crisis is called the pre-crisis phase. These are the weak signals that we've been receiving several months leading into the actual crisis. So if we look at January, February, even maybe December, we've been seeing stuff on social media, we've been seeing stuff in news reports about people in China wearing these masks, wearing these tubs on their faces. We've been hearing reports out of China about some deaths and about the coronavirus, but we weren't really putting much thought into it. So what do you do with these weak signals? Some people act upon it right away, but I think the vast majority of us don't. In every pre-crisis scenario, there's this mentality of downplaying things, of denying things, and I think we're all guilty of that, not just the government. Our healthcare system didn't stockpile. Our government system did not put the right actions in place fast enough, and we as individuals, we weren't stockpiling or getting anything prepared for it. We didn't stockpile or hoard anything until around, March or so? So I think we were late to the party just like everyone else was, and as a result, here we are. This is the reality of every pre-crisis scenario, because if we did prepare for it, we wouldn't be in a crisis. All right, the second phase is the crisis itself, and this is probably the most intense stage of it all. This is where you've got 100 things coming at you all at the same time. You're probably not sleeping much, and it is incredibly stressful. So let's play this out. If you were the president, what would that look like for you? First of all, you've downplayed stuff. You said everything is okay. You didn't want to create panic. And then all of a sudden there's a tipping point where boom, it hits. You realize that there's something off and that you can't control this anymore. And I think this is really the reality for us, at least in Canada here, when you started to see the numbers coming in from Italy about how many people were actually dying from this. On top of it, I think our Prime Minister's wife got hit with COVID. And then you started to see the NBA lockdown, the NHL lockdown, stadiums lockdown. You start to see really, really quickly how fast things all happened, and you realize, holy crap, I've got a huge problem on my hands. So what do? You want to reach out to your cabinet, you want to reach out to your right-hand people. So you've got experts who could be on different time zones, could be on different days, they could be sleeping right now, you can't get them on the line. You'd be talking to your health minister or your surgeon general, and they're seeing that their hospitals could be overwhelmed, they don't have enough supplies. So then you're trying to call these suppliers who aren't picking up their phones because other countries are calling them, and the president or the prime minister is looking for new data every hour so that they can talk to the journalists and the reporters that are calling them every minute. And what do you tell these guys? Because you're getting information from different sources. You don't know which information is actually true, right? And then you need to present yourself to the media and actually have a true statement so that people don't freak out or that people know exactly what's going on. And so in order for you to do that, you have to round up all this data as quickly as possible from different sources that in itself are hard to get. When we talk about the healthcare system, when we talk about ventilators, when we talk about frontline workers and getting hospital beds ready, that's just one part of the equation. The other part of the equation was, all right, well, we've got to self-isolate. We've got to social distance. What does that mean for the economy? What does that mean for businesses? Businesses can't pay for their taxes. They can't pay for their licenses. You've got states and provinces and cities that can't pay their bills to keep the operations running. And on top of that, you got a lot of people that are unemployed. You have to talk to your economic experts and your finance experts to figure out what the game plan is from that standpoint. And on top of it, again, you've got reporters that are coming from that angle and want to know what's going to happen next. What are we all supposed to do and how are we supposed to get through it? And that's just two parts of the equation. What about people that are suffering from mental illness, that have special needs? We haven't even gone there. There could be senior citizens that are trapped in their homes right now. We have no idea, but at the same time, the government knows that these are things that you address. It's just that the list is like this long and you can only tackle this part of the list. The crisis scenario is such an intense time. You're not sleeping much, and for every solution that you put in place, it adds on 10 more questions. Let's say that I was the president and I said, let's make sure our hospitals have enough beds. All right, well, where am I going to put all the other patients that are currently sick that aren't sick because of COVID? Got to figure out the hotel situation, open some stadiums up. All right, what about the logistics for that? Where am I going to get the beds for those? Who am I going to put in place? How am I going to pay for those? So for every solution you put, 10,000 more questions come up as a result of it, and they're all looking for direction from the leader. It is an incredibly fatiguing exercise. It's incredibly stressful. There's no sleep involved. But eventually, with all your might, somehow it gets resolved, most likely with a ton of casualties. And I would say that sometimes you're not really resolving it, you're just getting through it. And all you did was survive it. But eventually it does die down. Eventually the crisis either destroys everything in its path, but it has done its thing and is now past us. Or for other people, they may have been able to resolve and get ahead of it, although that is few and far between. In any case, it does get resolved. There are casualties that come with it, and then you move into the next phase. The third phase is called the post-crisis phase, and essentially, this is where we take the time to look back and see what the hell happened. How can we learn from this? What can we put in place to make sure that we don't run into this situation again? If that means stockpiling more supplies, if that means getting more ventilators, if that means getting more frontline workers, or if that means better isolation protocols, whatever the case it is, we have to implement those processes now so that we can address this for next time. And that's really the whole point of the post-crisis phase. It's about learning and using that to prevent this type of situation from happening again. In addition, we're probably going to see some casualties as a result of this. This is like the people that are going to fall on their swords to make it look like things are getting better, right? This is kind of like firing the coach who couldn't get the team into the playoffs. We're going to see some people resign. We're going to see some people get fired. And this is just the natural course of the post-crisis phase. And again, it's to show us that things are going to be different moving forward. So now that we have that context, what separates the companies that can land on their feet out of a crisis versus those that just falter or die? Well, really what it comes down to is, yes, you have your crisis management team, especially in the second phase of the crisis, actually addressing the crisis. You've got that. But the good crisis managers, what they do is they implement an A team. Now, this team is completely devoted to looking at the scenario from a distance. All they're doing is they're just looking at what are the results, are the things working, what's the takeaway, what's the perception from people, and they're starting to think about the next step. What are the likely worst case scenarios? What are the likely better case or best case scenarios within the reality of the situation? And then think of the plan to address those different types of scenarios. So for example, they're probably thinking, okay, if the president did die, what should they do? How should they spin it? What should they talk about? How do they communicate that to the public? And what are all the protocols in place to ensure that there is no disruption in government service? Another scenario could be, what if there's a huge spike in mortality rates in one state versus the next? And then how to funnel all the services and equipment over there as fast as possible. So in addition to these worst case scenarios, they are also brainstorming better case scenarios, right? They're thinking about, okay, how can we get the economy going as soon as this whole isolation thing is lifted? They're thinking about, how do we ensure that we have a good message for the public so that they feel protected for the next time? That means that we're going to promise the public that we're going to have the hospitals in place and the equipment in place. Let's start funneling equipment right now so that we can get the metrics and the quantities and the inventory counts ready to go so that we can report that out to the public so that they feel more comfortable. Essentially, what they're trying to do is think about, how do we get out of this situation, but in a positive tone? So the question now becomes, where does this leave you? Well, my advice to you is that you should become your own A team. You've got other people right now on the front lines. You've got government, you've got media that are pushing on the right buttons so that this crisis is addressed. And start thinking about the likely worst case scenarios and the likely good case scenarios and how you're going to address them or how you're going to get there. From a worst case scenario, that could be losing your job, that could be having to support your family, that could be losing your home. So right away, you want to build out those scenarios and figure out what your plan is to address those. Does that mean you need to get on government assistance? Does this mean you have to push back some payments? Think about what they call the 4 walls. You guys are a Dave Ramsey follower, you definitely know what I mean. And that means focus on food, transportation, utilities, and shelter. That's really where you want to go and build your plan towards that. That's number 1. So the next thing is to think about your best case scenarios. And I will say that life has essentially handed us the pause button, right? Everything is at a standstill right now. And as frustrating as it is for a lot of us, I think this is a really good opportunity for a lot of you as well to start thinking about what is the next phase in your life. What is your next phase in your career? I think a lot of you guys are still struggling as to what you guys want to do from a career option standpoint, or maybe what you want to do from a college education standpoint. You've learned out of this situation that you want to recession-proof your career. If you want to make sure that you're in an industry that is an essential service, here's the time to do that. How do you pivot? How do you transition away? What skill sets do you need? What education do you need? Start looking into all of that because you actually have the time and opportunity to do so. I know this is a very challenging time, but like any good crisis manager, you do not want to let this crisis go to waste. You do not let it control your life. And in fact, you want to become stronger for it. And so while COVID-19 has written the story, it has not written the ending. If you are new to the channel, know that I do offer career growth, tips, advice behind company lines. If you want more videos about your resume, cover letter interview, definitely check out my channel. Guys, thank you so much for watching. Be safe out there, and I'll catch you in the next one. Cheers.